everyone, and welcome to Youth Positively Speaking. My name is Paige Ewing, and I work at Prevention Resources as the multimedia specialist for Positive Youth. Prevention Resources is a nonprofit located in New Jersey that is dedicated to promoting health and wellness of individuals, families, and community through education, collaboration, advocacy, and treatment. We're excited to have a new partnership between Positive Youth and the Hunterdon County Partnership for Health to bring you this mental health mini-series. And for those of you who are new to the podcast, the Positive Youth Initiative is focused on building countywide capacity to reduce substance misuse among youth 9 to 20 years old in Hunterdon County. And the Hunterdon County Partnership for Health is a community collaboration dedicated to achieving optimal health for all residents. So today we have with us Liza McNamara with Hunterdon Healthcare Partners. Welcome, Liza, to the podcast, and please tell us a little bit about yourself.
Hi, my name is Liza McNamara, and I'm a social worker, and I work at Hunterdon Healthcare Partners, and I work with patients who have social determinants of health, such as homelessness, needing home care, food insecurity, housing insecurity, mental health, behavioral health. I refer them to different organizations in the community.
And we are so excited to have you today because last episode we were talking a little bit about anxiety in youth and what that looks like and what parents should be looking for. And so today, another issue that's been brought up is school avoidance. And this is becoming a much more common issue that we're seeing with students in our schools. And we wanted to give some parents some more information about the issue, what they should be looking for, what can they do, and all that stuff. So if you could kind of start us off, what exactly is school avoidance for those who don't know?
Well, like I said, I'm a social worker, but I'm also a mom who has a child who has gone through this. So school avoidance is a real disability. It's a real condition, but it's not recognized in the DSM as a mental illness at this time, but it falls under the umbrella of anxiety, PTSD, OCD, and basically, for whatever reason, the child, and it could be from kindergarten through high school, refuses to go to school. One day they just absolutely, that's it. I'm not going. And you can try everything, bribery, everything you can think of, but they physically will not get out of bed. And this can look like stomach ache. I have a stomach ache. I don't feel well. That's the most common, is having a stomach ache. But it also happens in the school. So a child will go to school, but they don't want to stay there. So they'll have frequent trips to the nurse's office, and that kind of thing.
And I think that's really hard for parents, right? Because it's like, well, if my kid's saying, "Oh, mom, I don't want to go to school. I have a stomach ache." I remember my mom would always be like, "Well, do you have a test today?"
Right. Or
So it's like, how is it different of a kid just having like that little bit of anxiety because of something versus actual school avoidance that is this disorder?
They'll start having symptoms of anxiety, sometimes blown into actual panic attacks. Where they may throw up, they may start to shake, obviously crying, inconsolable, but not, your child's cry. And this isn't, I don't want to go to school. This is a real distress cry. Sometimes it happens the night before also. That's huge.
And so, obviously going to school is a huge part of childhood, and our kids have been going to school, since preschool. So what can cause this? Like you said, it can sometimes happen seemingly overnight. And a lot of parents, I think, are kind of blindsided of being like, but you used to love school. What are some of the things that can cause this?
Anxiety, and this could be from bullying. And it's not just bullying from other kids, it could be bullying from a teacher. And OCD, PTSD, learning disabilities, when a child has a learning disability and they feel singled out from their peers because it's noticeable, maybe they're getting extra help. They just don't want to be in that position, and it's scary.
Mhm. And sometimes those things, they're unavoidable. You
Yeah,
have a
yeah,
learning disability
yeah,
and you do feel singled out. And there's unfortunately like
yeah.
technically nothing that you can do as a kid
No,
because that's just a part of who you are.
yeah,
And so
yeah,
that is incredibly difficult. And
yeah,
why it's
yeah.
so important to have really strong support systems in
Yes,
schools and at home for kids.
yes, yes.
So as a person who works in schools, as
Mhm.
a teacher, what are some of the things that people who are acting as these in-school supports should be
Right.
looking for?
Um, well, there are a couple things. As a parent with a child with school avoidance, sometimes you have to really be proactive in gaining that support from the school. Not to say that the schools aren't supportive, but since COVID, schools are recognizing social emotional learning more, um, to where a 504 or an IEP can be done more for social emotional disorders and not just learning disabilities. It's not just academic. So I would say, when the school recognizes if there's certain things that they can do that would alleviate some of the stress, one being letting the child, because a lot of times like crowded hallways are a huge trigger. So the teacher can let the child go a little bit earlier ahead of all the other kids to get to where their locker or whatever, or let them come in a little bit later, so that
Mhm.
that helps to avoid that rush. So especially social anxiety. Also, they can allow the child to have frequent breaks. Um, Go take a walk, um, go to your counselor, go see the social worker. Even things, such as a special code between the teacher and the child, tapping on the desk, or some teachers will have like a sticky note.
Mhm.
And if the child puts a sticky note on the corner of the desk, that signals without embarrassing him that he needs a break.
Mhm.
Um, And another thing that can be done um, before an IEP, which is completely valid for school avoidance, but you could try a 504, which is not a legal document, but it will outline different accommodations that may help the child. I know that with my son, the school the high school just went above and beyond. Um, for him, he went to an IOP. So an IOP and a PHP, partial hospitalization and intensive outpatient program. They're programs where the child will go either for a full day every day or a couple days after school or half a day. So during these programs, they have group therapy, individual therapy, medication management, family therapy, and they're usually short term, 2 weeks or so. And within that time, they're transitioned back into school. And sometimes instead of just throwing them right back, you can make a schedule where, okay, you're going to go to school from this time to this time. And
Mhm.
then, or you're going to go 3 times a week right now for the first week. And the next week, we're going to increase it. You could do that. Or you can do, one day a week, you're going to go for 2 hours. And then we're going to slowly increase that until they can stay for the whole day.
Mhm. Yeah. And I love hearing that there are so many variations of options
Yeah.
because, you know, every single situation is so unique for every single student.
Yeah,
And there are so many reasons, like you mentioned, of why this might be happening. We live in
yeah,
the post-COVID world,
yeah,
which I like every time we have an episode, we're like, we're not going to
yeah,
talk about COVID.
yeah,
But whether we like it or not, it's having a huge impact on our
yeah.
kids. So whether
Well,
it's that fear of getting sick or bullying or
right, right.
academic issues, there's so many different things that students
Yeah,
need because they have so many
yeah,
different reasons
yeah,
for if they have school avoidance
yeah,
for school
yeah.
avoidance.
Well, one of the interesting things during the pandemic and during lockdown, kids who had social anxiety were thrilled. They were relieved that they didn't have to go to school. But it was the kids who were more social that really retreated and isolated. And those, unfortunately, were the kids who had suicidal ideation and developed depression and anxiety. But as far as the kids with the school avoidance, it was like,
Mhm,
it was like one less thing they had to worry about it. And some of them thrived on distance learning.
mhm.
So
Yeah, and I think you're absolutely right where some kids did great and some kids really didn't. I mean,
yeah,
that was
yeah,
something at Prevention Resources, we do substance misuse prevention.
right.
And we
Oh yeah,
saw a lot of kids with an uptick in substance use
absolutely.
because they were at home. So they could, they started
Yes.
vaping and
Yeah,
they could then do it the whole time and they developed a nicotine addiction.
yeah,
And now that they're back in school, they
yeah,
can't vape all the time. And so a lot of
yeah,
schools have seen an uptick in students vaping in the bathrooms,
yeah,
them doing it in classrooms. I know a lot of our
yeah,
high schools have now installed vape detection devices in the
right.
bathrooms to
Yeah,
try and
yeah,
slow down this
yeah,
addiction that started
yeah,
over
yeah,
COVID as a
yeah.
coping mechanism.
Yeah, and it's also used as self-medication,
Hmm.
for anxiety. You know, you can kind of retreat a little bit and use whatever substance to kind of help that anxiety.
Yeah, and so we've been seeing those students as well, though, having school avoidance
Yeah,
because
yeah,
now they can't do the behavior as often
yes,
as they could.
absolutely.
And so that's, another factor that parents have to be aware about.
Yeah,
Uh,
yeah,
so many things feed
yes,
into this issue.
yeah. Um, and as a parent, increased isolation is huge. You really need to keep an eye on your child, try to get them as engaged as you can in family activities. And if you find that they're really retreating and isolating, you definitely want to seek the help of a professional, whether a social worker or a psychologist. And they may need, therapy, which of course I always recommend. I think it's wonderful for everybody. But
Mhm,
they might need um, therapy and actually need medication.
mhm,
There are a lot of medications out there that really, really help anxiety and school avoidance, and that as well as different cognitive approaches that the parents can do. And another cause of the school anxiety I forgot is separation anxiety.
mm.
Just, if you have a child who when they were little, I want to be mommy, I want to be daddy, and they had that trouble separating, that can still be present even as
Mhm.
they get older.
Yeah, and I think when we look at school avoidance too, it can look very different for an elementary school child versus
Oh
a middle
yeah,
school versus a high school or an
absolutely.
elementary school. You might have more of those full out tantrums, in
Yeah,
the
yeah,
morning, the
yeah,
screaming, the kicking, the
yeah,
crying
yeah, yeah,
versus high school. It might be a little bit more subtle
yeah,
than that,
yeah,
obviously. So
yeah,
could you talk about that
yeah.
of like what that might look like, especially for parents who might
Right.
have an elementary versus middle versus high school?
Yeah. Well, like you said, yeah, at younger ages, it could be a full-blown tantrum. Some kids actually throw up and they actually get themselves so worked up that they throw up. Um, Middle school could be panic attacks, which are terrifying. Panic attacks are terrifying, especially for a child. I mean, you feel like you're dying, the body goes through fight or freeze. Um, it's very scary. Um, and then high school again, isolation, drug use, keep an eye on um, text messages, social media posts, that kind of thing, to look for any indication that there's suicidal ideation or substance abuse, substance misuse.
Yeah, and I'm so
Yeah.
glad you brought up the social media thing
Oh
because
gosh. Yeah.
oh goodness. I mean, we work in the schools at Prevention Resources, and the amount of times that we have had schools come to us now saying, we need to do a program about social media because the things that go on, and
Mhm,
especially for a child, if they're having issues at school,
mhm.
and now those issues are following them home at the device
Yeah.
that they carry around 24/7,
Yep.
and they
Yep.
can't
Yep.
escape it.
I
That
know. Yeah.
absolutely can lead to so many other
Oh
issues
gosh.
rather than
Yeah.
just not wanting to go to school.
Yeah. 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 Absolutely.
Yeah.
Yeah.
And so obviously, this episode is for parents and to be able to talk to their kids. So
Yeah.
if a parent is starting to see these behaviors, how do you
Mhm.
recommend that they even bring this up to their kid to be like, hey, I
Yeah.
think I'm concerned about you?
Yeah. I mean, obviously asking, is anything going on that you want to talk about? And they may talk about it, they may not. That's try to keep an open line of communication at all times, make sure that the parents are conveying that you're not in trouble. Um, with my son, I had people telling me, um, just pick him up and throw him in the car, at, and he was in middle school. It's like, I actually had professionals tell me that.
Mm,
Pick him up and throw him in the car and bring him. Um, I've had people tell me, well, if you just disciplined him more, or if you gave him more chores, this wouldn't be happening. And that was so frustrating. And, you have to decide whether emptying the dishwasher is worth possibly triggering your child to have suicidal thoughts.
yeah.
It's not. But to other parents who aren't going through this, they have no idea. Um, I think just making sure that you are keeping open lines of communication, making sure that the child knows that they're not in trouble and that you're there for them. And most of all, that wherever they go, they are safe. They're in a safe environment. Make sure that they know that when they go to school, if they need to speak to somebody, it's okay to leave class.
Mhm.
And also, keep that communication with the school. Something that helped me, and we were talking about social media. There are a lot of really great support groups for parents and for everything. And I found one specifically for teenagers with social anxiety. And it's been amazing because um, every little victory that you would think, like my child took a shower, like
Mhm.
that's huge. And, everybody's like, "Well, okay, well, he's supposed to take a shower."
Mhm.
But when you say that to a parent of a child with anxiety, everybody's like clapping and, because they know how difficult it is. So you might, look for support groups that way too.
And I think that brings up a really great point that we talk to our kids about all the time, but I sometimes think we forget to mention to the parents, and that's building your systems. So
Oh
for
yeah.
the kids, we talk about who are your trusted adults? They don't
Mhm.
necessarily have to be your parent. That's okay.
Yes.
But have
Yep.
your coaches, have your
Yep.
teachers, have your
Hmm.
principal, your school nurse, your counselor,
Yeah.
all these other people, your Girl Scout troop leader, your
Yeah.
Boy Scout troop leader, whoever it is, to have this system of care
Yeah.
around you for when something happens. And I think it's so important for
Yeah.
parents too, of, that
Yeah.
whole it takes a village.
Yeah.
For parents
Yeah.
to say, okay, I know I have the school counselor in my pocket.
Right.
I have the,
Mhm.
principal, but also I have these moms who are great on this resource
Yes.
who are willing to hear me.
Yeah.
I have my pediatrician who's willing to
Yeah.
offer me support. Again, going out to
Yeah.
your kids' coaches and saying, look,
Yeah.
my son is having a really hard time in school. Like, as a
Mhm.
coach, can you just kind of look out for him?
Mhm.
And
Yeah.
having those systems is so important because
Yeah.
then our child has other places to go to other
Yeah.
than us if
Yeah.
they don't feel like
Yeah.
talking to us.
Yeah. And unfortunately, a lot of parents find that you're not going to get as much as support from family members and close friends because they don't understand. And they're like, well, what do you mean he doesn't want to go to school? He's got to go to school. And then they'll start that if you'd only done this, if you'd only done that, you need to be tougher, you need to spank them, and they just don't get it. So picking supporting them to get it, like other parents going through it, is definitely better.
Yeah. Well, I'm so happy that we had this
Mm,
conversation today because I think, like I said, in this post COVID world, a lot of parents are coming across this issue that they might
yeah,
not have had before. And so I'm so glad that we talked about kind of building those systems of care. What is school avoidance? What parents
yeah,
can do? Definitely reaching out to the schools and
yeah,
professionals. Like you
yeah.
said, therapy, we talk about all the time on this podcast. It's a magical thing.
It is, it's magical.
But so for parents, is there anything else that you would like to tell them about
Mm,
this issue, what they should be looking for, and even just people who serve and support students and young people, what
yeah.
they should be looking for or know?
Um, just try to build self-confidence in your child any way you can because with anxiety disorders, PTSD, especially learning disabilities, the the self-confidence really, really takes a hit. So even if they're, taking out the great, thank you for taking out the garbage. You did a great job on this. I see you're really trying and you're doing a great job on doing this, or, you've really improved doing that and that kind of thing. And just be there to listen and don't get angry. Um, if you do, don't do it in front of the child. Take to one of these support groups or other supports and just be honest because nine times out of 10, what you're thinking is horrible to think. Other parents are thinking it also.
Yeah, you're definitely not alone in this
No,
issue. Yeah.
no, and that's huge.
Mhm.
Yeah,
Well, I want to thank you so much for coming onto the
sure.
podcast today. I, of course, want to also thank the Partnership for Health for their partnership in this
Yeah,
episode. And for parents, if you need more information and resources, we always encourage you to visit our website, njprevent.com/positive youth. We throw tons of resources, research ideas, and things like that up there. And we want to thank everybody for listening in today. And we'll see you next
yeah.
time for more Youth Positively Speaking.